nervous system, and musculoskeletal disorders. The nervous system, I think the majority of you know what this involves. It involves the brain and the spinal cord. But no, within the nervous system, there are two different areas. There's the central nervous system and then the peripheral nervous system. And right now, the picture that's up here, I said it's just the brain and the spinal cord, right? But that's actually the central nervous system. The peripheral nervous system is everything that branches off from here. So all the nerve fibers that come off of the brain and then the spinal cord are included in the nervous system as well. Nervous system disorders can affect both the mental and the physical function for the patient. They can affect the ability to speak, to understand, to feel, to see, to hear, to touch, to think, to control bowels and bladder, and to move as well. So everything is controlled by your nervous system. Okay, that brain is your powerhouse. One of the disorders that we deal with a lot in our work area is going to be a stroke. I've talked about it a lot this school year because we see it so much, okay? Patients that are post or after stroke. A stroke is considered a stroke and a CBA. You're going to hear the medical providers, the doctors say CBA, CBA, CBA. That means stroke, okay? It's a brain attack or a cerebral vascular accident. This is a disease that affects the arteries that supply blood to the brain. There's been some kind of incident with the arteries that supply blood to the brain. When a stroke occurs, one of the following happens. It could be that a blood vessel in the brain bursts, okay? Bleeding that occurs in the brain, and it's called a cerebral hemorrhage. Or a blood clot blocks the blood flow to the brain, and then the brain's not receiving that oxygenated blood, okay? And that causes damage. Stroke is the third leading cause of death in the United States. What did I say was the second leading yesterday? Yesterday's lecture, I said cancer, thank you, was the second leading cause of death in the United States, with stroke being in third, okay? But stroke is the leading cause in the United States of disability in adults. Okay? Warning signs may last a few minutes to hours as well. And those warning signs are called a TIA, or a transient ischemic attack. Okay, and that ischemia means tissue death, okay, or not receiving that oxygen. Stroke risk factors. What makes people more at risk for having a stroke? Okay? High blood pressure, cigarette smoking, exposure to secondhand smoke, heart disease, diabetes, any past history of TIAs or that transient ischemic attack. Age 55 and older, being overweight, lack of physical activity, birth control puts people more at risk for stroke, and a lot of different heart disease problems as well, as listed here. Stroke can occur very suddenly, right? Or it can come on kind of slowly. The patient may have warning signs, and those are the things we're looking for. Have you guys ever seen the warning signs with stroke that say the acronym FACE? So you're looking for facial droop, arm weakness. You're looking for those things, okay? And those are quick and early warning signs. They might have sudden numbness or weakness on their face, their arm, their leg, but especially on one side of the body. It's typically the left side of the body, but it doesn't have to be. Okay? These patients also have sudden confusion, trouble speaking or understanding speech. They have trouble seeing in one or both eyes. They start having trouble walking, being dizzy, loss of balance or coordination, and maybe a sudden severe headache as well. Which, if that artery bursts, then that's what's causing that headache. Does that make sense? The patient could also have nausea, vomiting, and memory loss. They could lose consciousness, so they could go unconscious. They could have noisy breathing, high blood pressure, a slow pulse, redness of their face, seizures, and hemiplegia could happen as well. So half their body go completely useless anymore. The patient could lose their bowel and bladder control and their complete ability to speak as well. If the stroke patient survives, some brain damage is likely. It could be very small or it could be much larger. Functions loss depend on the area of brain damage or where the event happens, and rehabilitation starts in the ER, okay, or starts immediately. The healthcare team helps the patient regain the highest possible level of function with that rehabilitation. This is showing you possible areas, like the entire brain is where the stroke could happen. But if it affects the taste area, then that could take that out. If it affects the speech area or the Broca's area, then it's going to take out their speech as well. And the further it gets without being treated, the more it typically takes out. So this is showing you a brain scan, okay? And this is showing you a healthy brain. You see lots of color here. You see purple, you see yellow, you see green, you see some reddish orange as well, okay? That's a healthy oxygenated brain that's functioning well. Well, when we get into a vegetative state, so the patient is breathing, but maybe with assistance or stuff like that, but more than likely not ever going to walk or talk, okay? Vegetative state. Their brain looks like this. We're not seeing any green, yellow, orangish red, or anything like that. But we're still seeing the tissue there. Right? We're still seeing that the tissue is there. It's just not very oxygenated, to be really honest with you. And this is not good. This is not good. But then we get to the worst, which is brain death. There's no oxygenation going on to the brain anymore. Right? The patient is completely brain dead. We are keeping them alive by medications and ventilation, mechanical ventilation on a machine. And these patients, once we can get these scans, which is sometimes harder than it may seem, the physicians, the social workers, and the whole healthcare team is going to get involved with all of these, okay? But they're going to get involved and they're going to start talking end of life care. What can we do to help this family, assist the family with end of life care for this patient when we see brain death? Okay? The next disease or disorder is called Parkinson's disease. There's always a question on the CNA test about Parkinson's disease. Always, always, always. It is a slow, progressive disorder with no cure. Movement is affected. The big thing with that CNA test likes to pull on this is safety. These patients shake. They can fall a lot. They're very at risk for safety concerns because of the movements going on with their body that the Parkinson's is causing. Any patient over the age of 50 is at risk for Parkinson's. The signs and symptoms become worse over time. They include tremors, rigid, stiff muscles in the arms, legs, neck, and trunk, slow movements for the patient. They can also have a stooped posture and impaired balance, and they can also have a mask-like expression. So the mask-like expression, you good, Jane? Okay, you're okay. You can get water if you need to. A mask-like expression, they don't have any facial expression. They're not smiling, they're not grimacing, they're not anything. It's just staying the same. Other signs and symptoms develop over time. Often the tremors start in their hands, and then we can do kind of some rehabilitation with them. There are some medications, but they don't fix it. Okay, they can decrease symptoms, but they do not take it away. Okay, they do not take it away. These patients have a very slow, shuffling gait. Gait means their walk, right? So that's why they're at risk for falls. That is the biggest CNA question on here with Parkinson's, is that they are at risk for falls and they are a safety concern for us. Make sure and watch them closely. Treatment, there are some drugs or medication to treat and control the disease, but not take care of it. We work with these patients with exercise and physical therapy to improve their strength, posture, balance, and mobility. And then if they have problems with speech or swallowing problems, then we work with them with therapy on that as well. They eventually may need help with eating and self-care, and then normal elimination like bowel and bladder programs is going to be the goal here. The big thing again is safety measures are needed to prevent falls and injuries from happening with these patients. The next nervous system disorder is going to be multiple sclerosis, or MS. It is a chronic disease. I swear, in nursing school, every single nursing student I was with, by the end of learning about multiple sclerosis, I'm talking about it for just a second here. I swear by the end of it, we all thought we had MS. And I mean, some people were taking it so far as to go get all these scans done, and MS is not a quickly diagnosed thing. It takes many months and so forth. But I swear, it was just one of those diseases in nursing school that everyone had after, which is not good at all. But none of them actually got diagnosed. But we all thought we had, for sure. With MS, the myelin of the spinal cord, which covers the nerve fibers in the brain and spinal cord, is destroyed. Then the nerve impulses are sent to and from the brain, and they're not sent anymore in a normal way. Okay? There is no cure for MS. There's things that weaken the symptoms and so forth, but it takes a lot of different tests and studies and months, maybe a year or more to get diagnosed with MS. But a lot of it is like, oh, do you feel tingling down your arm? Well, guess what? At some point in our life, we all feel tingling down our arm. Okay. So that's the kind of things. It's like, oh, we learn these signs and symptoms and so forth, and we start to think, oh, we've had that before, like blurred or double vision. Okay. Muscle weakness in the arms and the legs, balance and coordination problems, tingling, prickling, or numb sensations, partial or complete paralysis, pain, and speech problems. Yesterday, I could not get my classroom cooled down at all once I had that heater on. Also, these patients also have tremors, dizziness, concentration, attention, memory, and judgment problems, depression. They struggle with bowel and bladder. They struggle with sexual function, hearing loss, and fatigue. They're very, very tired or very, very tired easily. The biggest things patients can do when they first get diagnosed with MS, if it's at a young age and they're still working and so forth, is keep doing what they already do. Okay? It's the patients that stop working because they got diagnosed with MS, or they stop doing their exercise that they were previously doing because they got diagnosed with MS. They do terrible. Okay. I know a lady in our community, she's a few years older than us. She's been diagnosed with MS for probably 10 years. And she can just continue at her job. And she has some days that, when she gets home from work, she can't do much. Okay, she's exhausted. But she still goes and does. And that's the biggest thing the doctor told her is don't make life-changing decisions here. Right. As soon as you get diagnosed with it, because actually not doing anything is going to make the disease progress very, very quickly. MS itself can present in many ways. We talked about all those symptoms, but they can last for a few weeks or a few months. The symptoms may gradually disappear or come back and forth and so forth. That means that the patient is in remission. At some time, though, then the symptoms flare up again and so forth. The patient's condition gradually declines with more and more symptoms, and then there are no remissions after that. And these patients have to be kept active as long as possible and as independent as possible. So this is not an automatic, I'm on disability kind of thing. Okay? If you get MS, it is not. They figured this out. Sure, in the 80s and maybe in the 90s, they might say, oh, you can't work, you have MS. No, not anymore. Okay? They found that will actually hurt you. Okay? Or potentially even kill you. Because you have to stay active. ALS is amyotrophic lateral sclerosis. It's a disease that attacks the nerve cells that control voluntary muscles. It's also called Lou Gehrig's disease. Okay, and you might have heard about this on the TV or maybe with some people you know. It is very, very progressive, so quick acting and fatal. It is. ALS is more common in men. It usually strikes between the ages 40 and 60 years of life. Motor nerve cells in the brain, brainstem, and spinal cord are affected with this, and the cells stop sending messages to the muscles. The muscles then weaken and waste away or atrophy and twitch. Over time with ALS, the brain cannot start voluntary movements or control them. So this starts to affect your muscles that are very important, your heart, your diaphragm, things you need to live every day, your pulse, your breathing, and so forth. ALS has no cure. Okay, there are drugs maybe to slow it down, but it has no cure. And we also try to keep these patients active. We also tell them, even though we are honestly giving them a timeline on their life a lot of times, we tell them to keep working, keep active, keep exercising. It is going to help you live longer. Okay. But these are the type of patients, I'm going to be real honest with you, that will say, you need to come up with a plan for your family. Okay, and I'm not saying it's going to be quick, but you need to be thinking about the future. What do you, what do you plan for your kids? Okay, it may be a year, it may be 5 years, but you need to work on a plan. Head injuries result from trauma to the scalp, skull, or brain. And so traumatic brain injury occurs when a sudden trauma damages the brain. Brain tissues are bruised or torn in this scenario. Bleeding can be in the brain or in nearby tissues, and then spinal cord injuries are likely with these as well. Causes from these brain injuries are motor vehicle crashes, is going to be number one there. Falls, assaults, firearms, and sport and recreation injuries as well. Death can occur at the time of injury or later. If the person survives, some permanent damage is likely. Last year, did you guys watch the movie Me Before You? You did watch it? Okay. I typically have Miss Evans show it. I haven't said anything to Miss Martin, but I think I have it. So the patient, he got a brain injury on a snowboarding act. Snowboarding? Shoot. Me Before You? Maybe I'm thinking of a different one. I think snowboarding. Motorcycle. Okay. Okay. Yeah. Yeah, you're right. But he was a snowboarder, right? Okay, that's where we're going with this. Right, but he was on a motorcycle and he had a wreck.
No, he was just trying to walk.
Ah, been too many years since I watched this movie. Right, super sad movie, right? But it's got a great storyline. And there's a lot of different things. The reason why I have our show Nicole Science One, there's a lot of different things to think about in this movie. And some kind of hidden under things that I'm going to talk about even after today with that movie as well. Disabilities depend on the severity of the brain injury here and the site of the injury. They include cognitive problems, sensory problems, communication problems, behavior and mental health disorders. They could be in a state of stupor, which is an unresponsive state where the patient can be very, very, very briefly aroused and awakened. The patient could be in a coma where the patient is unconscious and they're not responding. They're unaware and they cannot be aroused at all. This is again where we talk about this vegetative state versus a persistent vegetative state as well. With the vegetative state, they can still have a sleep-wake cycle and periods of being alert with the vegetative state, okay, with that brain. But with a persistent vegetative state, that means they're in that vegetative state for more than 1 month, okay? And rehabilitation is required. Spinal cord injuries can permanently damage the nervous system. Young men are the most at risk for them. Common causes are stab or gunshot wounds, motor vehicle crashes, falls, sports injuries. Problems with it depend on the amount of drainage damage done to the spinal cord and the level. The higher up, the worse it is. Okay, the higher up. Yes. So the higher the level of injury, the more functions are lost. Lumbar injuries here. Lumbar is going to be your lower back area, your lower part of your spinal cord. This is going to affect function loss in the leg, so it could create a paraplegia here. Thoracic injuries, so more in the middle here, your thoracic vertebra. This could be lose function below the chest, okay, which could be a paraplegic. And then if you get up here in the neck and the cervical injuries, they're going to be the worst. And they're going to create that quadriplegic or tetraplegic and kind of cover throughout the whole body, besides kind of the brain up here. Okay. If the patient lives through this, they have a lot of rehabilitation. They have to learn to function at their highest possible level. They need to use self-help devices, assistive devices, and others as well. They could live independently with a lot of support or with home care facilities or maybe even long-term and assisted care facilities as well. Another nervous system disorder is autonomic hyperreflexia. This occurs with spinal cord injuries above the mid-thoracic level. So it's going to be above here on our back and then below the neck, so in between here and here. There's an uncontrolled stimulation of the sympathetic nervous system here. If it's untreated, stroke, heart attack, and death are at risk. Treatment involves raising the head of the bed for 45 degrees or having the person set upright if it's allowed, and determining and removing the cause from this happening. Okay? The most common causes, look, what can cause this? A full bladder. Okay. Also constipation or fecal impaction, and then some skin disorders as well that are affecting the nervous system. We're going to move forward here to the musculoskeletal system. So this is a lot of disorders as well with bone, joints, muscles, and so forth. Musculoskeletal, these disorders, they affect the movement of the patient. Okay? Injury and aging are very common causes of this. Arthritis means joint inflammation. Arth is joint there, and itis is inflammation. It is the most common joint disease. Pain, swelling, and stiffness occur, and then the joints are very, very hard to move. Osteoarthritis, look, there's a new word in front of it there that means degeneration of the bone and so forth. So osteoarthritis is the most common type of arthritis. Causes include aging, being overweight, joint injury, stress, muscle weakness, and heredity with osteoarthritis as well. Scares me every time that's not going to work. Signs and symptoms of osteoarthritis include joint stiffness, occur with rest and lack of motion. Pain occurs with weight bearing and motion, and then swelling is common after using the joint. There is no cure for osteoarthritis. Okay? No cure. Treatment involves drugs to decrease the swelling and inflammation, heat, and sometimes cold applications, but these patients do use a lot more heat applications for this. We also want them to continue to exercise, rest and joint care, weight control, healthy lifestyle, and possibly joint replacement surgery in certain areas as well. We need to make sure that falls are prevented here. Help is given with activities of daily living. Heat will relieve pain. That's why as people get older, they don't like the cold as much. Okay? Their joints don't hurt as much in the heat. Good body mechanics. We want to start to teach them good posture. And adaptive self-help exercises for hands and wrists are become useful during this time too. Weight loss, if weight loss is needed, it can really impact or reduce stress on weight-bearing joints and help prevent further joint injury. And then there are arthritis support programs that help the patient develop a healthy outlook as well. Rheumatoid arthritis, so we were just talking about osteo. Rheumatoid arthritis is a chronic inflammatory disease. It causes joint pain, stiffness, swelling, and loss of function. It is more common in women than in men, and it usually develops between the ages of 20 and 50. RA occurs on both sides of the body. It doesn't have a favorite. The joints become very tender, warm, and swollen. Fatigue and fever are common for no reason at all. This is an immune disorder, okay, that we talked about yesterday. RA varies from patient to patient. The wrist and the finger joints near the hand are often affected and very, very swollen and warm and so forth. But other joints are affected as well, including the neck, shoulder, elbows, hips, knees, ankles, and feet. And this patient just doesn't overall feel well. Treatments for RA are to relieve pain, to reduce inflammation, to slow down or stop joint damage, to improve the well-being and ability to function for these patients. The patient's care plan may include rest balance with exercise, proper positioning, joint care, weight control, measures to reduce stress, and measures to prevent falls as well. This is a patient here with these bony growths called permanent nodes here, and this patient has rheumatoid arthritis as well. And then these patients also can have some joint replacement surgeries, but emotional support is needed too for them. Total joint replacement surgery, they're going to completely replace that joint with metal or some kind of synthetic material, whether it's some type of plastic or something like that. Okay? The term arthroplasty is the surgical replacement of a joint. The damaged joint is completely removed and replaced with an artificial joint, and that artificial joint then becomes what's called a prosthesis. The surgery is done to relieve pain, to restore joint function, and to correct a deformed joint as well. Osteoporosis, okay? Osteoporosis is very, very female dependent, but all ethnic groups are at risk for it. Older patients are very at risk for it. This is when the bone becomes very, very brittle and can break easily, okay? The risk for women increases after menopause. Pregnancy, menopause, and all that stuff sucks the calcium out of a female's bones. And so that is why they are more at risk for osteoporosis. Spine, hip, wrist, and rib fractures are very common with these patients. And then the lack of estrogen after menopause and low levels of dietary calcium cause these bone changes. Other risks for osteoporosis include a family history, being very thin or having a small frame, eating disorders, tobacco use, alcoholism, lack of exercise, bed rest, and immobility as well. Signs and symptoms of osteoporosis include back pain, gradual loss of height, stoop posture, and fractures. Preventive measures, we're going to supplement them with calcium and other vitamins like vitamin D as well. Estrogen for some women, exercising with weight-bearing joints, strength training, not smoking, limiting alcohol and caffeine, walking aids if needed, safety measures to prevent falls, good body mechanics, and so forth. Fractures. A fracture is a broken bone. Right, fracture is a broken bone. They can be either open or closed. A closed fracture is a simple fracture. It's the one that's most commonly done here. The bone is broken, but the skin is intact. An open fracture is also called a compound fracture, and these are the most dangerous because the broken bone comes through the skin, and these patients are major at risk for getting infection. Causes include falls, accidents, bone tumors, metastatic cancer, and osteoporosis for fractures. The problem with fractures is they come with pain and swelling and loss of function, or limited or no movement of that body area. They can also cause deformity, and bruising and skin color changes happen at the fracture site as well. For healing, the bone ends are brought into and held in a normal position. It may have to do surgical or non-surgical. This is called reduction or fixation. After reduction, the bone ends must not move for a while. The person is going to be in cast or traction. And then they're going to be using also splints, walking boots, and external fixtures are also used with these patients. If we have patients with traction, this is a steady pull from two directions. So a pulley coming from two different directions, holding them in place. We're going to use weights, ropes, and pulleys. Traction could be needed for neck, arm, leg, or pelvis. And then this skin traction is applied actually to the skin. Skeletal traction is inserted through the bone. For cervical traction, through the neck area, tongs are applied to the skull. These patients are a lot to take care of, but we have to do it, and they're very, very good. So this is going to be considered traction here, a pulley system, and so forth. Okay? This is showing you a picture of a cast here. Cast cannot get what? Wet. It cannot get wet. Even if it's a waterproof one, we would prefer you to wrap it up and so forth. This is showing you cervical traction. Look, does this look comfortable? They can't move their head at all. All right. Hip fracture prosthesis. Pillows are used to create that wedge there, and then this is a traction system. They're going to use that trapeze bar because they can still use their upper body. Hip fractures or hip breaks, these are very, very common in our patients. Very, very common. More at risk are women, but men do it too. Very, very common diagnosis. Healing is slower in older people. You need to remember, though, that there are some life-threatening risks with this. They can have respiratory complications with the surgery. UTIs or blood clots are another thing they're going to be at risk for. Also, we need to watch out for those pressure injuries, those skin injuries, or those wounds and so forth, constipation and confusion as well. The fracture of a hip requires an internal fixation or surgery. They can have a partial hip replacement or a total hip replacement. Okay? And then they do need rehabilitation or therapy after this surgery. With loss of a limb, an amputee. An amputation is the removal of all or part of an extremity. Most amputations involve the lower extremity. Common causes include severe injuries, tumors, severe infection, gangrene, or vascular disorders. Here's a nice picture. Everyone look up here.
Oh.
Yeah. So guys, so gangrene is the death of a tissue. Blood flow is affected with this. The tissues do not get enough oxygen and nutrients. Tissue death happens. These are black toes up on the screen here. Those of you that are not in the classroom right now. Tissues become very black, cold, and shriveled. This causes infection or could be from infection, injuries, and vascular disorders. Surgery is needed to remove this dead tissue. Gangrene can also cause death because it causes sepsis throughout the body. And then possibly, not in this situation, a prosthesis or artificial replacement for a missing body part may be needed. The patient that has an amputation, they get this pain called the phantom pain. They think that the limb is still there, and that is very, very common. Okay, lower limb amputations are common in older patients for sure. After an amputation, most need long-term care or temporary or on a permanent basis as well. So they can't just go and get a prosthesis immediately. They're going to have a stump for quite a while. That stump has to completely heal before a prosthesis happens. Make sure we're not talking or on our phones is what I'm seeing as well. We have one more chapter left. One more chapter left. Cardiorespiratory, and this is a big one, and lymphatic disorders. So this is the heart, okay? And as we get to A&P coming up, we are going to learn that blood flow through the heart, and A&P is for everyone, not just CNA. As we're going to study back the blood flow through the heart and so forth. The heart is a muscle, right? And there are a lot of different disorders with it. This is going to be the vascular system, so the arteries in the red, and then the blue is the veins. And so the red is the oxygenated blood, and then the blue is the unoxygenated blood on the picture here. With cardiovascular disorders, it looks like I have 19 pages of disorders here, and some of them take up multiple pages, but the circulatory system or the cardiovascular system delivers blood to the body cells. Okay? Problems that occur could include hypertension, which is what? What is hypertension? High blood pressure, thank you. Coronary arteries disease, which is CAD. Angina, which is chest pain. Myocardial infarction, which is a heart attack. Heart failure, and then dysarrhythmias too. With hypertension, a high blood pressure or hypertension, the blood pressure is 140/90 or even higher than that. Pre-hypertension, they're in that range is 120 to 139, and their bottom number is 80 to 89. Causes of hypertension include, but are not limited to, narrow blood vessels, kidney disorders, head injuries, and some pregnancy problems, and then tumors as well. The problem with hypertension, why we want to take care of it, is because if it goes on too long, it can lead to a stroke, hardening of the arteries, heart attack, heart failure, kidney failure, and blindness. Lifestyle changes can lower blood pressure, also medications and so forth. But they're going to try to teach patients about a diet low in fat and salt, maintaining a healthy weight, regular exercise, not smoking, limiting alcohol and caffeine, and managing stress and sleeping well are going to be huge things to decrease blood pressure as well. In coronary artery disease, the arteries become very hardened and narrow, and the blood flow just doesn't get through. Okay, then the heart muscle gets less blood and oxygen, as well as the brain. The most common causes here is that hardening or the atherosclerosis, like the buildup of fat in those arteries. And major complications with this come chest pain, which is angina, heart attack, irregular heartbeats, and then sudden death. The more risk factors, the greater the chance of coronary artery disease and its complications. It can be treated. Okay, we need to relieve the symptoms, stop the atherosclerosis. You might need a roto-rooter in those arteries. Okay, honestly, lower the risk of blood clots, widen or bypass clogged arteries, and reduce cardiac events by doing this. Some of the things they might recommend is to quit smoking, to exercise, to reduce stress, eat a healthy diet, and if overweight, lose weight. So this is showing you a picture of a diet high in fat, or maybe just a family history of this. Could cause this plaque to build up, and then there's less and less blood that can travel through these. Okay? If a person has an event, like a heart attack, if they've had any surgeries that cardiac-wise, then they are going to need cardiac rehabilitation. The cardiac rehab team includes doctors, nurses, heart specialists, heart surgeon, exercise specialists as well, and physical and occupational therapies. There's two different parts to cardiac rehab. There is the exercise training, and then there's the education, counseling, and training as well. Angina. This is chest pain. This comes from reduced blood flow to the part of the heart muscle. Heart muscle is called myocardium. It occurs when the heart needs more oxygen. It is described as tightness, pressure, squeezing, and burning on the chest. All of these could be locations of chest pain or angina. Symptoms of angina can be relieved. Often rest is going to relieve them within 3 to 15 minutes. Also, we can have something called a nitroglycerin tablet. for angina. It is taken when angina occurs. The patients that have this prescribed to them, they know the instructions on it. They can take it up to 3 times, 5 minutes apart. If their chest pain is not relieved after that, they need to call 911. They need to call 911. Some patients also have these nitroglycerin patches, but things that cause that chest pain or that angina need to be avoided as well. With a heart attack or an MI, part of the heart muscle actually dies in that event, and then also sudden cardiac death or cardiac arrest can occur. There are several different names for a heart attack. Okay, it's MI, it's heart attack, acute myocardial infarction, acute coronary syndrome, coronary thrombosis, coronary occlusion, and so forth. What happens though, the blood flow to the heart is stopped and it's blocked, and then that area of that muscle dies. A heart attack is a medical emergency. 911 needs to be called. The patient needs to get to the ER immediately. Efforts are made to relieve pain, to restore the blood flow back to the heart, to stabilize their vital signs, to give oxygen, to keep the person calm, and to prevent death and life-threatening problems that are going along with it. The patient may need medical or surgical procedures to open or bypass the diseased artery, and then they're going to need cardiac rehabilitation after that. Heart failure or congestive heart failure. Okay, heart failure is a scary word, but a lot of our older patients, they have heart failure. It's kind of natural for you as you get in your 80s and 90s for you to have some form or type of heart failure. Heart failure does not mean grandma's going to die next week. Okay, that's just a term that the heart is slowing down, the heart is weakened, it cannot pump normally. But that heart failure is a very, very scary to the patients and to ourselves as well. Okay, but a lot of people start off with acute or that short-term heart failure, and then it can lead into congestive heart failure or just heart failure in general. When it's the worst situation, the left side of the heart cannot pump the blood normally, and then the blood backs up into the lungs with congestion, and then respiratory congestion occurs. Okay, they get very, very congested respiratory wise, and they can't breathe. It causes that difficulty in breathing. They have increased sputum, cough, and gurgling sounds in their lungs when they have CHF. When the right side of the heart cannot pump, that blood backs up into the venous system. This is when the feet and the ankles swell, their neck veins bulge, they have liver congestion, and then their abdomen is congested with fluid. A very, very severe form of heart failure is pulmonary edema, and this is fluid in the lungs. When I've made a reference in the past about giving a NICU baby Viagra to treat pulmonary hypertension, that's because they're having heart failure on the pulmonary side. Okay? And so we're trying to widen that blood flow and so forth, and so that is what we are treating, that pulmonary edema. Common causes of heart failure are coronary artery disease, AMI, hypertension, diabetes, age, irregular heart rhythms, damaged heart valves, and kidney disease. Treatment for this, medications are ordered to strengthen the heart. Drugs are ordered to reduce the amount of fluid in the body. So they're going to be on those water pills. So they're going to have to pee a lot. Okay? Lasix, furosemide, any of those meds, they're going to say, I need my water pill. They feel a lot better because they can breathe better. Also, they need to be on a low salt diet. Oxygen is given to them. They may need to be setting an upright position to breathe better, and that's semi-Fowler's. In the patient, we need to reduce all the coronary artery symptoms. A dysrhythmia, one of the biggest, and not completely the biggest, but one of the big problems with the heart is an abnormal heart rhythm. Okay? The rhythm could be too fast, too slow, or irregular. How many of you guys have said, oh, my grandma or my dad, my whoever is an AFib? Sometime in our life, we will all actually go into AFib if we make that far. So AFib is a dysrhythmia, but there's a lot of different treatment options and so forth, and then some people just live with it every day. Dysrhythmias themselves, there's lots of different ones that are abnormal heart rhythms. AFib is just one of them. It's changes in the heart's electrical system. It could be from artery disease or heart attack or heart failure. It could be from drug and alcohol abuse. It could be from excessive caffeine intake. It could be from thyroid problems, some drugs or medication. While some dysarrhythmias are very minor, others are completely life-threatening as well. Treatment depends on the type of dysrhythmia that the patient has. Drugs could be given to correct it, or a procedure may be needed as well. Some patients are going to need a cardioversion or a defibrillation, where they go in and do an electrical shock on the heart. And this is all outpatient. It's done in like 15 minutes, and the patient is sedated just a little bit, and they don't feel any of that shock. They may also need an ablation. This is an area of tissue in the heart so an abnormal electrical signal are destroyed. And that is a very quick procedure too, but a little bit more invasive. Then there are some patients that need an internal device, and that internal device is called a pacemaker. And this device is inserted under the skin near the heart, and it monitors and regulates the heart's rhythm. And also there's something called an implantable cardioverter defibrillator. So this is for the patient that may be born with an abnormal heart rhythm, and it is going to be implanted into the patient, and it delivers a shock when the heart is in its life-threatening rhythm. Okay? Some devices can both be a pacemaker and an ICD. Next up, under this cardiorespiratory disorders, is going to include viral hemorrhagic fevers. This is coming from viruses, okay? And some of these can start off as mild illnesses, but then they gradually get worse. These viral fevers can affect many different organs, damage blood vessels, and impair the body's ability to regulate itself, and could cause hemorrhage as well. The natural reservoir or host for these viruses is an animal or an insect. These viruses are usually found in the areas where the host lives, and then humans become infected with contact from them. With these, the patient can then spread the virus to others and cause outbreaks. There is no cure or drug treatment for most of these. One example of this is going to be Ebola. It is a severe and deadly hemorrhagic fever. It is caused by the Ebola virus. Signs and symptoms of Ebola can appear from 2 to 21 days after exposure, and usually symptoms though appear within the first 8 to 10 days. This is one of the reasons why they ask every single patient when they walk into the ER if they've traveled outside the country. So signs and symptoms of Ebola include a fever greater than 101.5, severe headache, muscle pain and weakness, diarrhea, vomiting, and abdominal pain, and then hemorrhage. These patients start to have bleeding from the eyes, the ears, the nose, the mouth, and the rectum. Okay? Then they also typically end up showing a bleeding rash that covers their body as well. This is very, very scary. The virus enters the body through non-intact skin, so like through an opening or a mucous membrane. It is not spread in the air, water, food, or insects. Okay? The healthcare though team, once we confirm a patient has it, we have to prevent the spread of it. So we have to put on a full PPE, so gown, mask, goggles, face shield, and gloves. And then it has to be carefully removed and discarded to prevent any further contamination. The next area here is respiratory disorders. And we remember that the respiratory system brings in oxygen and removes carbon dioxide from the body. Common respiratory disorders or problems that we're mainly going to talk about here are going to be COPD, chronic bronchitis, asthma, sleep apnea, influenza, pneumonia, and tuberculosis. With COPD, it involves two different disorders. It includes chronic bronchitis and emphysema. Okay, that's what COPD is. It's both of those together. Risk factors for COPD include cigarette smoking, pipe, cigar, and other tobaccos, or exposure to secondhand smoke as well. Not smoking is going to be the best way to prevent COPD. COPD has no cure. It affects both the airways and the alveoli. The airways and the alveoli become very elastic, and then the walls between them are destroyed. They start off, the airway walls become very thick, inflamed, and swollen, so not as much air can move then. And then the airways are also clogged by excessive mucus secretion as well. Chronic bronchitis occurs after repeated episodes of bronchitis. Patients that get bronchitis, and as you get older, if you get it every winter and then you struggle to get rid of it the rest of that winter. Okay? Smoking is the major cause of bronchitis, but also infection, air pollution, and industrial dust are risk factors as well. Smoker's cough in the morning is often the first symptoms of bronchitis, and treatment involves the patient must stop smoking. They may need oxygen therapy and breathing exercises, and then that respiratory tract infections need to be prevented. With emphysema, the alveoli enlarge and become elastic. As a result, some air is trapped in the alveoli when exhaling. Over time, more involved, O2 and CO2 exchange cannot occur, and so oxygen is not getting in there. And like I said, smoking is the most common cause of this. The patient is going to have very shortness of breath and a cough, but their breathing is easier if we can set them upright and slightly forward. With asthma, the patient their airway becomes inflamed and narrow. Extra mucus is produced as well. So many of these have very similar symptoms. They include dyspnea, so difficulty breathing, wheezing and coughing, pain and tightness in the chest, and so forth. We got to listen to that one young lady over here with asthma, right? And some wheezing and so forth. Asthma usually is triggered by allergies, and so they try to treat the allergies as well. Sudden asthma attacks can occur, but asthma is treated with drugs and medication. Sleep apnea. This is pauses in breathing that occur during sleep. They can last from a few seconds to over a minute's time frame. They can occur many times during one sleep, and the most common cause is the blockage of the airway. So when a patient is congested, then they are more at risk for sleep apnea at that time. Obstructive sleep apnea. During sleep, the muscles in the throat relax and soft tissues collapse, closing the airway. Central sleep apnea. This is more to do with the brain than the obstruction. This occurs when the brain doesn't signal for the patient to breathe, and the muscles to breathe. Signs and symptoms of sleep apnea include pauses in breathing during sleep, loud snoring, waking during sleep with gasp or shortness of breath, difficulty staying asleep, daytime sleepiness, headache in the morning, and dry mouth or sore throat after sleeping. Treatments for mild sleep apnea include lifestyle changes, weight loss, quitting smoking, and avoiding alcohol and sedatives before sleep. In more severe sleep apnea requires surgery or possible CPAP devices as well. The next respiratory disorder is influenza, and that's what we get our flu shot for. That's the same thing. Okay? It is a respiratory infection caused by viruses. Older patients are going to be the greatest risk for this, and pneumonia is a common complication with it as well. Treatment involves fluid and rest, drugs ordered by the doctor for symptom relief, and to shorten the flu episode. Coughing and sneezing spread this flu virus, and so that's why you have to put on the proper PPE when you're taking care of these patients. The flu vaccine is going to be the best prevention for the influenza. Enterovirus D68 or enterovirus. This can cause mild to severe respiratory illness. This virus is found in saliva, mucus, and sputum. It includes coughing, sneezing, and touching contaminated surface. Then touching the eyes, nose, and mouth can spread this infection. Symptoms include fever, runny nose, sneezing, coughing, body and muscle aches, dyspnea, which is difficulty breathing, and wheezing. There is no vaccine to prevent this. You should protect yourself from others, wash your hands often, avoid close contact, cover cough and sneezes, avoid touching the face with unwashed hands, and so forth. Pneumonia. This respiratory disorder is an inflammation or infection of the lung tissue. The affected tissues are filled with fluid, and it's difficult for the patient to breathe or exchange that oxygen and CO2. Bacteria, viruses, and other microbes are causes from that. These microbes reach the lungs by being inhaled or breathed in or aspirated as well. Children under the age of 2 and then adults over the age 65 are most at risk for pneumonia. Factors that increase the risk of pneumonia are smoking, aging, stroke, bed rest, immobility, chronic diseases, and tube feedings. Treatment may include that drug for that infection and pain, the increased fluid intake to treat the fever and thin secretions, IV therapy and oxygen, and then that semi-Fowler's position to ease the breathing process. Tuberculosis is the next respiratory disorder. It is a bacterial infection in the lungs. It can occur in other body parts as well. If TB is not treated, that patient can die. TB is spread by airborne droplets with coughing, sneezing, speaking, singing, or laughing. Those who have close, frequent contact with infected patients are going to be most at risk, or living with them, poor nutrition, and so forth. TB can be present in the body but not cause signs and symptoms, so that's why we do the TB testing, because it can not show you any signs or symptoms. Chest x-rays are going to confirm tuberculosis, but we start out with TB testing because we don't want to just give someone radiation just to do it, okay? Treatment for TB includes the patient covering their mouth and nose, flushing these tissues down the toilet, placing them in biohazard bag, and so forth. There are some drugs or medications. Some of them include antibiotics as well. And then we need to make sure and do hand washing after contact with sputum from a patient. The last section here of chapter 50 is really what it is lymphatic disorders. And this lymphatic system is the green on the picture here. I know it's kind of probably hard for you to see, but our lymphatic system runs throughout our entire body. The lymphatic system is what drains our extra fluid from our tissues. It helps us fight off infection and absorbs and transports fats as well. Disorders included in this, there are not that many, but there's lymphedema and lymphoma that are going to be the big ones here. Lymphedema is the buildup of the lymph tissue causing swelling. It occurs when there's a blockage or damage to the lymph system. Causes could include cancer, infection, surgical removal of the lymph nodes, scar tissue, or absent or abnormal lymph nodes as well. Lymphedema usually takes place or affects the arm or the leg. And daily activities do become affected by this. Damage to the lymph system here with lymphedema cannot be reversed. Treatment for it, though, includes elastic garments or bandages, exercise, good skin care, and massage therapy. They're trying to work out that lymphatic system, trying to get that extra swelling and edema out of there. We want to control the swelling, decrease pain, improve movement and use of the body part, and allow for daily activities. Lymphoma is cancer involving cells in the immune system, or lymphocytes. Lymphocytes are a type of white blood cell that protect the body from infection. They're found in lymph nodes. And in lymphoma, those cells do not function normally. They're abnormal cells. The two main types of lymphomas are Hodgkin's lymphoma and non-Hodgkin's lymphoma. The lymphoma itself begins with an abnormal lymphocyte, and then the abnormal cell divides and makes more and more and increases. That mass then, because of the abnormal cells, develop into a tumor. Any questions about cardiorespiratory or lymphatic tissues? Okay. I'm going to